Agenda item overview. Setting a mutually agreed agenda at the beginning of each session is crucial and essential to CBT. It establishes structure, clarifies goals, and promotes client engagement. The agenda acts to help both the therapist and client stay focused on the goals of the session, increases efficiency, and encourages the client's active participation. Once the client and therapist collaboratively identify the main topics, the therapist might also integrate session-specific goals and follow up on previous topics. A typical agenda begins with a brief review of events of the week. The therapist might invite the client to summarize key events and note any emerging issues. This is followed by a review of the last session, including the topics discussed, follow-up points, and homework assigned. Assessing the client's current mood is also important and may be done formally through standardized measures or informally, such as asking open-ended questions, such as, has your mood changed since last week? Any scales used should be documented. Homework review can offer valuable insight into the current functioning and provide a bridge to the present session. The discussion then shifts to the main session topics, which may include symptoms, external stressors, or relevant life events. The therapist should clearly explain which CBT techniques will be used and how they apply to the client's goals or presenting problems. Once the agenda is finalized, a rough time outline should be shared. While the structure should be maintained, flexibility is key. If high-risk content arises during the session, the therapist should pivot the agenda accordingly, ensuring the client is informed and supported. To use the agenda effectively, therapists should summarize key points, use clarifying and reflective questions, and create intentional pauses between topics to help maintain focus and build rapport. Homework assignments should be treated as a key agenda item with at least 10 minutes reserved to collaboratively set, explain, and clarify expectations. The session concludes with client feedback on how helpful the session was, key takeaways, and any final thoughts. In video 1, the therapist engages the client in a brief catch-up on how the client has been feeling over the last few days through informal techniques. This is used to assess the client's current mood. The therapist uses reflection to confirm how the client is feeling. They talk briefly about previous homework, CBT topics, which is on automatic thoughts, and how it worked for her throughout the week. This serves as homework review. However, the therapist fails to bridge how last week's process, automatic thoughts, will be applied to this week's topics. The clients explain feeling overwhelmed, but the therapist doesn't explain how the current process or skills will help with that. The therapist is successful in prioritizing agenda items based on risk level. When prioritizing, the therapist considers the factors like urgency, emotional distress, and the relevance to the client's formulation. This allows the clients to have agency in the agenda setting of the current session. As we move to the main topic, there is no clear explanation of the skills being taught this session. The therapist does not explain if they will be introducing a new CBT topic or furthering discussion on automatic thought processes. Although a brief outline is shared, the therapist doesn't provide a breakdown of the structure of the session before asking what she wants to talk about. This might inhibit staying on track. The therapist is successful in giving the client space to talk, reaffirming her thought processes through reflection and check-ins, and by asking her to prioritize. Even though she struggles to answer the questions about ranking the importance of her goals, he still gives room to express herself and reiterates the point of the exercise and prioritization. Based on the information the client presents, he then prioritizes the item with her consent, demonstrates what they'll talk about, sets the structure loosely, and confirms that she is comfortable with the agenda. The homework assignment for the current session and time for feedback are not included in the video. In video 2, the therapist explains bridging to the client, referencing the last session and the BDI test results. The review of last week uses both standardized and open-ended questions to inquire into how the client was feeling. The therapist asks for a mood on a scale today and over the week, comparatively to last session, which also serves as a review of last session's topics. The therapist asks for feedback on last sessions by asking what resonated with you last week and references the 5-model scale. This contributes to both the review of the events of the week and the review of last session. This can also bridge to the current conversation. Because the client has used technique outside of the session and explained an increase of control and understanding, this also impacts the review of last session. In the review of the reflection of the week, the client explains they can't identify how they're feeling and what CBT techniques they found useful, serving as an indication into the client's current mood. The therapist then inquires into the client's statement of having low points and thoughts they experienced in the previous week and asks them to expand on that. This allows for the bridge to the current topic and setting the agenda for the day. The therapist then brings in activity scheduling, explaining the main CBT topic of the day, which is behavioral activation. The therapist confirms that the client is okay with that and the present prioritization of agenda and the homework assigned. When they shift to the main topic, the therapist asks for relevant topics giving power to the client in the session, including the symptoms, which were the low points and lying in bed, and then clearly explaining how the current CBT techniques will apply to the client's goals or presenting problems. The therapist does well establishing homework assignment as part of the agenda, bringing in activities and explaining why this applies to the client's current issue and what this will look like. Using a model that resonates with the client to assess why he didn't feel good, bridges together last week's topic and current topics. The therapist doesn't ask for feedback at the end of the session, but this might be the design of the video. Preference of style. Establishing the agenda. Video 2 demonstrates a more structured and collaborative CBT session, better adhering to the agenda setting framework. It includes mood tracking, structured feedback, technique explanation, and active prioritization. Video 1, while the therapist was empathetic and client-centered, lacks clarity in structure and does not fully leverage CBT's direct elements. My preference would be to integrate the reflection and alliance building of Video 1 with a more formal structure like Video 2. The two videos demonstrate different approaches to agenda setting with CBT. Video 1 takes an informal client-led style. The therapist allows space for the client to reflect openly, but there's a clear structure missing. It does not connect past content, CBT skills, and current session goals. There's a limited explanation of the techniques, and the agenda is not explicitly set at the beginning of the session. This may create lack of focus, direction, and make it hard to stay on track. In contrast, Video 2 provides a structured and collaborative approach. The therapist introduced the session with a mood check and references the previous work, such as the BDI and the 5-factor model. The agenda setting is clear, and the therapist helps the client prioritize concerns, explaining which CBT strategies will be used, behavioral activation, activity scheduling, and establishes homework expectations. This style supports the client's autonomy while still maintaining therapeutic direction. I prefer the style demonstrated in Video 2. It adheres more aligned to the CBT principles, particularly in its emphasis on structure, transparency, and client collaboration. It also promotes efficiency and helps ensure that the session time is meaningful. Setting a clear agenda, providing rationales for interventions, and reviewing progress all contribute to building client engagement and self-efficacy. This approach also aligns with my personality and emerging therapeutic style. I value clarity, consistency, and goal-oriented work. I tend to naturally be organized and thoughtful about pacing, and I believe clients benefit from knowing what to expect in a session. At the same time, it's good to remain flexible and responsive to client needs, which the therapist in Video 2 demonstrates by checking in and adapting to the client's emotional state. In my personal experience attending therapy, I benefited from knowing how to determine my progress and what we were measuring. While I recognize the value in creating space for open-ended dialogue, like in Video 1, I believe that combining empathy with structure, like in video 2, best fits the CBT model and my personal strengths. Common difficulties related to my practice. 1. Coming across as too directive or controlling. Because I value focus and clarity, I tend to jump into structure quickly. While my intentions are to be efficient and goal-oriented, this can risk feeling abrupt or overly controlling to some clients, especially those who haven't been in a CBT structure before or with strong preferences for unstructured conversation. Clients might resist structure if they perceive it as invalidating or if they're not accustomed to the model. To avoid this, I can explicitly frame agenda setting as collaborative. I can say something such as, I want to make sure that we spend time on the stuff that matters most to you. Can we figure out how to use today's session? 2. Cutting off client expression too early. Sometimes my bluntness can make me efficient at keeping sessions on track, but this might mean I jump to problem solving before the client has fully expressed their experience. Structuring or redirection can lead to ruptures in the therapeutic alliance, particularly if the clients feel unheard or rushed. To combat this, I can use what is referred to as gentle interruption with affirmation. For example, I can say something like, I want to make sure we're following what's most important. Want to make sure I'm following what's most important. Can I pause you for a moment to check in or clarify? Splitting time between open exploration and structured work can help meet those needs. 3. Pushing for prioritization when clients feel overwhelmed. As someone who's focused on outcomes, I may feel tempted to push clients to choose a direction quickly. However, overwhelmed clients may shut down or say, I don't know, because they can't access clarity in that moment or they feel that I'm overwhelming them. In these cases, I can use multiple choice prompts or focus on symptom impact. For example, would it be helpful to talk about the tiredness or the stress at work today? If prioritization still feels hard, even framing one item as an experiment, such as, let's try focusing on this today and see how it goes, can lower the pressure and re-engage the client in problem solving. Overall, my personality traits help create a clear, active, and purposeful therapy space. To make agenda setting most effective, I can lead into strategies that balance directness with empathy, collaboration, and being flexible to the client's emotional state. This should allow me to stay focused without sacrificing the therapeutic relationship.